Hi friends, I'm sure you have heard the condition called Myasthenia Gravis. Our famous Bollywood actor, the icon Amitabh Bachchan had this particular disease. Similarly, our former Chief Minister Achirrandan had the same disease. They had additionally thymic lesion, there is a tumor in the thymus gland as well. So what is myasthenia gravis? The term means there is severe muscle weakness, but in fact it's a disease, an autoimmune disorder. Okay, what happens is usually there is a connection between the nerve as well as the muscle. There is a junction called the synapse, through which the acetylcholine goes out and attached to the muscle membrane. In this particular disease, there is some antibody which blocks the action of this acetylcholine so that it won't be able to exert its action to have the contraction of the muscle. You know this. There are two types of muscle: the smooth muscle as well as the voluntary muscle. This particular condition affects the voluntary muscles. That means every action for looking up, down, speaking, talking, moving, walking, climbing, all action except the smooth muscle of the esophagus, stomach, GIT and all, it won't be affected by this particular condition. So the commonest symptom would be ptosis. That means a drooping of the eyelids. When you read for some time, there will be double vision and the eyes comes down just like a curtain. It will be normal like this. After some time, on prolonged viewing or watching, the eyes will slowly come down as though you are sleeping. Secondly, there will be difficulty in speaking. You speak for maybe 2-3 minutes. After some time, the speaks become illegible, dysarthric or with a slow tone. Similarly, if you chew for a long time, if you chew a chapati or a hard material, the chewing would become less effective with each bite, so that you may have to support with your hand. Okay, that's otherwise the jaw drops down. Similarly, if you swallow, this wouldn't come down to the gullet and this would come out through the nose called a nasal regurgitation. Similarly, if you keep your hands like this for 30 seconds or more, this naturally comes down because he won't be able to keep this for a longer time because there is a failure of the neuromuscular transmission. Okay, that means from the nerve, the synapse, through the synapse, the acetylcholine won't come out effectively, and even if it comes out, it won't bind to the muscle. There are many types. There are in the neonates called a neonatal myasthenia. In the young stage can be congenital myasthenia. It can be a juvenile. Rarely it can comes in the children, but usually it's a disease of the below 40 females and above 60 males. And there is one more cancer or autoimmune related muscle weakness called Eaton-Lambert syndrome or LEMS syndrome. Okay, there is a problem with the transmission from the muscle membrane. So as I've mentioned, there are so many physical manifestations. There can be weakness of the hands and the body, of the legs and all. Sometimes there can be difficulty in taking breath. In that case, you may have to undergo ventilation, ventilator support, oxygen support and all, may need admission. So the usual precipitants are certain infection or certain medication or even stress can precipitate a respiratory or a myasthenic crisis. The usual investigations are, one is particularly the history. The person would be perfectly normal in the morning. After some time, the eyes droops down, or if he keeps, or you can go up, you can climb stairs for maybe a flight of stairs. After that, there will be buckling. You won't be able to climb upstairs because you would fall down. Similarly, if you are walking, after some time your knees give way and you would fall. Similarly, that means for initial few minutes or for some time you would be able to walk normally or do your activities. After that, there will be fatigue or be weakness of that particular acting muscle. Okay, there are certain rare conditions called metabolic myopathy, motor neuron disease and other condition can similarly act in the same way, but the manifestation would be different. Where it usually is a new onset disease with failure of the energy after some time. Maybe you won't be able to complete that particular act. One is history, or if you keep some ice in a packed plastic bag and you keep for 2 minutes, the closed eye will open up after for more than 2 millimeters, or you look up for 30 seconds, the eyes will slowly come down just like a curtain. Okay, yeah. So apart from the history, that means there is a progressive weakness, for progressive fatigue of the muscle by evening, especially in the evening, and the certain the ice pack test and other fatigue test and all. Then the other tests requires X-ray chest to look for any lesion in the chest or a CT thorax. So similarly, you can ask for a repetitive nerve stimulation test, where you give repetitive stimuli in a particular machine, and after some time you would feel that there will be fatigue of the conduction, okay, for fatigue of the muscles, repetitive nerve stimulation test. Or you can do a neostimin test, where you inject atropine by a neostimin, and you would feel the improvement after some time, maybe after half an hour. So similarly, there are antibody tests like acetylcholine receptor an antibody, or you can have anti-musk antibody, anti-titin antibody, anti-agrin antibody, anti-LRP4 antibody. Many antibodies are there. Once you diagnose this myasthenia gravis, or you suspect it's a myasthenia gravis, after doing all this investigation, the treatment would be either it can be a conservative treatment for some time, or you can also add steroids or immunosuppressant along with this. And suppose if you found a lesion in the chest, this may have to be removed by a thymectomy. Sometimes so if the patient comes with a severe fatigue and muscle weakness and respiratory insufficiency, you may have to ventilate the patient for some time, and may have to give intravenous immunoglobulin or plasmapheresis. You should know that in the 1900s, the cause of death was respiratory paralysis in 70% of the patients, 70% of the patients. But nowadays it hardly 3 to 5%, because of the awareness by the public, by the doctors, as well as the better care in the hospital, probably the immunosuppressive medication, the thymectomy, the ventilatory support, and the other multimodalities treatment which is available throughout the world. So I think I could give you an idea what's regarding myasthenia gravis, the clinical manifestation, the investigation, the treatment, and the prognosis. Usually, if you give medication, they would do well, normally, and they'll have normal longevity. You don't have to worry much, and you have to continue the medication. And for some people, it might be confined to the eyes alone, called ocular myasthenia gravis. For some people, it will be generalized, or can be many different types are there. So okay. So if you have any queries or comments, you are welcome to do so. Thank you very much. Bye.